Hello friends. When we go for a vacation, long or short, we need to prepare, right? But what if we encounter an unexpected scenario while on vacation? What to do? In this example, everybody must be with presence of mind to beat this vacation killjoy menace. So, experiencing a stroke while on vacation is frightening and stressful experience, especially when you are in unfamiliar surroundings. However, if you are with someone who knows what to do can save your life or anybody's life. Knowing what to do in such a situation can make a significant difference in the outcome. It can prevent death and any possible permanent long-term complications. This video will guide you what to do if you or someone else experiences a stroke while on vacation, including recognizing the signs, seeking help, and managing the aftermath. But first, let me remind you that this educational video is brought to you by Travel Dove's channel. Please support my channel so that I can continue to make videos like this. Kindly like and subscribe below. Get help super fast. The most important action to help someone experiencing stroke or any medical emergencies is to get immediate help. While waiting for help, assess and observe the person using Be Fast. This is an acronym used to help people recognize the signs of a stroke. These letters stands for balance, eyes, face, arms, speech, and time to call help. Balance, sudden loss of balance or coordination. Eyes, sudden trouble seeing in one or both eyes. Face, face drooping on one side or numbness. Arms, arm weakness or numbness, especially on one side. Speech, difficulty speaking or slurred speech. Time to call emergency services if you observe any of these signs. If you or someone you know experiences any of these symptoms, it's crucial to seek immediate medical attention. Time is critical in treating a stroke, so don't delay in calling for help. Recognizing early warning signs of a stroke can be crucial for prompt medical intervention and better outcomes. These warning signs, often referred to as transient ischemic attacks, TIAs, or mini-strokes, can occur before a major stroke and should not be ignored. Do not ignore sudden severe headaches, transient and sudden weakness or numbness, often on one side of the body, that may come and go. Difficulties or slurred speech or difficulty finding the right words, which may resolve quickly. Sudden blurred or decreased vision in one or both eyes, which may last for a few minutes to hours. Sudden onset of dizziness, loss of balance, or coordination problems. A sudden, severe headache that may be accompanied by other symptoms such as dizziness, nausea, or vomiting. Sudden confusion, trouble understanding speech, or difficulty speaking. Sudden onset of extreme tiredness or fatigue that is not related to exertion or lack of sleep. If you or someone else experiences any of these symptoms, even if they are temporary or seem to resolve, it is important to seek medical attention immediately. The Be Fast acronym is a helpful tool. If you or someone else experiences any of these symptoms, it's essential to act quickly. Call emergency services immediately and provide them with your location. Stay on the line and follow any instructions given to you by the operator. Call 911. So, be sure to know the local emergency number before your trip. Again, experiencing a stroke while on vacation can be a frightening and disorienting experience. While waiting for emergency medical services, EMS, to arrive, it's crucial to remain calm and take immediate action. When you are in the emergency, call to 911, provide correct information. When you call emergency services, provide them with your location, the person's age, any known medical conditions, and the symptoms they are experiencing. This information can help the EMS team prepare for the situation. Stay with the person. If you are with someone who is having a stroke, stay with them and provide reassurance. Keep them calm and comfortable while you wait for help to arrive. Check the person's vital signs, such as pulse and breathing, and be prepared to perform CPR if necessary. Do not offer food or drink. It's important not to offer the person food or drink, as they may have difficulty swallowing, which can lead to choking. Keep track of time. Note the time when the symptoms began, as this information can help healthcare providers determine the appropriate treatment. If the symptoms worsen or change, be prepared to provide this information to the EMS team. By recognizing the symptoms, calling for help, and providing support while waiting for EMS to arrive, you can help improve the person's chances of a full recovery. Keep the person calm and comfortable, and make sure they are lying down with their heads slightly elevated. Do not give them anything to eat or drink. If you are traveling with others, inform them of the situation. They can help provide support and assist in communicating with medical personnel. If you are in a remote area, find out where the nearest medical facility is located. If possible, have someone drive you there or arrange for an ambulance to transport you. Once you arrive at the medical facility, provide the healthcare providers with as much information as possible about the symptoms and when they started. This information will help them determine the best course of treatment. This may include undergoing tests, taking medication, or undergoing rehabilitation therapy. If you have travel insurance, notify your provider of the situation as soon as possible. They can help coordinate your care and provide assistance with any related expenses. Consider repatriation. Depending on the severity of the stroke and condition, you may need to consider repatriation to your home country for further treatment and care. Repatriation of an emergency stroke vacationer involves arranging for their safe return home for further medical treatment and care. This process can vary depending on the individual's condition, location, and travel arrangements. Here's a general guide on how repatriation might be managed. The first step is to ensure the stroke survivor receives appropriate medical care at the vacation destination. This may include evaluation, stabilization, and initial treatment at a local hospital. Contact the stroke survivor's healthcare providers at home to inform them of the situation and seek guidance on the next steps. Coordinate with travel and insurance companies to arrange for the stroke survivor's safe transport home. This may involve air ambulance services, medical escorts, or other specialized transportation options, depending on the individual's condition. In some cases, a medical escort, such as a nurse or doctor, may accompany the stroke survivor during the repatriation process to ensure their medical needs are met during travel. Ensure that the stroke survivor is medically cleared for travel by the attending healthcare providers. This may involve obtaining medical certificates and documentation required for travel. Coordinate logistics such as ground transportation to the airport, wheelchair assistance, and other support services needed for the journey. Arrange for follow-up care and rehabilitation services at home or in a healthcare facility upon the stroke survivor's return. This may include physical therapy, speech therapy, and other treatments to support recovery. Ensure that the repatriation process is covered by travel insurance or the relevant insurance policies. This may include coverage for medical expenses, transportation, and other related costs. Keep the stroke survivor's family informed throughout the repatriation process, providing updates on their condition and travel arrangements. Repatriation of an emergency stroke vacationer requires careful coordination and planning to ensure their safe return home for continued medical care. After receiving medical treatment, it's essential to focus on recovery. This may involve physical therapy, speech therapy, and occupational therapy. Experiencing a stroke while on vacation can be a challenging experience, but knowing what to do can help you navigate the situation more effectively. Again, by recognizing the signs, seeking help promptly, and following medical advice, you can improve the chances of a successful recovery. Thank you for watching. I hope you learned important safety tips in my video. So, enjoy a safe vacation. Please like and subscribe below. See you in my next video.